Across Maine, organizations are working hard to provide kids, teens, and families with the mental and behavioral health care that they need.
Sweetser alone serves more than 20,000 Mainers every year through statewide programs. But as Scott McDonald shows us, demand is soaring, resources are struggling to keep up, and the crisis is growing.
I mean, would you say it's safe to say that the need has never been greater for the amount of young people across the state that are looking for some help?
Yeah, I would say in the 20 years that I've been doing this work, I have not seen such a great need. I think it is the largest that it has been.
On Sweetser's serene Saco campus, Chief Program Officer Christy Worcester shared what they're seeing and what they're hearing from Maine's youth and families.
I think particularly in Maine, a lot of our youth are struggling with anxiety, depression. We have a lot of ADHD, of course, and things like loneliness and isolation.
That loneliness and isolation is hitting one group in Maine especially hard. Young girls.
You've really dug in, you and your team at Sweetser, and found some troubling and really alarming information and revelations when it comes to young girls.
There's a real struggle with this age group and comparing themselves to others. And this can lead to an increase in anxiety, an increase in depression. We see prevalence with eating disorders, and this same population is also struggling with, suicidal thinking. And, Maine has an increase in suicide with teenagers. And so this is definitely a concern for us.
Do you see a correlation between things like social media and a comparison, right, of not being good enough or not being pretty enough or not being thin enough? Is that sort of where that's coming from?
Yes, absolutely. And that's exactly what it is.
When it comes to help, kids are asking, but the system is struggling to answer.
So what we're hearing from families, particularly in rural areas of Maine, is there are service deserts where they cannot access mental health services. And so we need to figure out a solution to that because we are in the midst of a youth mental health crisis.
Sweetser has been working to close that gap, fighting those waitlist numbers with boots on the ground support through their ACT teams.
A team-based approach to supporting youth and their families out in the community, out in their home environment where they feel naturally supported by behavioral health professionals, by peer support specialists, by 24/7 crisis support.
Programs that are making a difference. But right now, too many kids in Maine aren't just slipping through the cracks, they're falling into an abyss. As these experts tell us, without more funding, it won't change.
If I were to name the two most important ways to help right now, I would say screening all children in the state of Maine and funding school-based therapy.
For Maine's Total Coverage, I'm Scott McDonald.